We have a special guest from Austin, Texas, the owners of Eastside Movement, Amy Hooper and Anthony Ruscitto. Anthony is a longtime college friend of mine. Amy, we're meeting right now. Very excited to have you on. And the two of you have been doing some pretty special stuff and stuff that I've been very interested in. And I wanted to give you an opportunity to kind of talk about what you've been doing and share that with the community that I'm trying to grow. And so I'm going to turn it over to both of you, let you tell your own story. I'll just sit back and I'm just here to ask some questions.
So we are both physical therapists. We own a company called Eastside Movement Company, which is in Austin, Texas, like you were saying. I've been a physical therapist for about 6 years now, and we met in January of this year. He was my student at another clinic that I worked at. Yeah, we hit it off pretty well, and then we're like, well, seems like we should just like start our own company because we like working together. So let's do that.
Amy, how long have you been in the field? What have you been focusing on?
Yeah, so I graduated in May and became a physical therapist then and started treating in July after I took my boards exam. And it's a bit of a bold move to start a company right out of school and to go into business for yourself. Anthony and I at the clinic that we met at has a specific treatment style that makes a lot of sense to both of us. It's from a group called the Postural Restoration Institute. We were both really drawn to the specific sort of exercises that group puts out that are really different from other exercises, from other sort of treatment philosophies that both of us had studied. Both had low back pain that it helped resolve. And we tried a lot of other things for low back pain before finding postural restoration separately and then before meeting each other. So we're really bought into postural restoration and to some other sort of different, interesting concepts we think that there aren't enough people talking about. So we decided to go into business together because we want to treat the way that we think is best, and working for someone else and working in a clinic, a different clinic, it's hard to do exactly what you want when you're working for somebody else. At least it was sort of within the like constraints that we had. So we said, all right, well, the way that we like to treat is similar enough that we get along where we can bounce ideas off each other, and our goals for the future in terms of like work-life balance, what our goals are in terms of like wanting to own a business and wanting to be our own bosses, aligned. And the pandemic was starting up then. So we said, well, I'm probably going to have a difficult time getting another job anyway. So let's just do it.
Yeah, let's just see what happens.
There's a huge problem in that the public's conception of physical therapy and really of a lot of healthcare in general is that people do not know how to take care of their bodies. They don't know in a lot of ways, right? And they don't know maybe necessarily where the best place to get help is, or people don't know even the difference between a lot of different healthcare providers because it's confusing and there's a lot of overlap between them. Some people think that physical therapy is just like something for your grandma, or something for like after you have a surgery.
When you break a leg or something, yeah.
When you break a leg, something big like that. What we want people to know and what most physical therapists want people to know is that we are movement system specialists. So when it comes to neuromusculoskeletal problems, so if it has to do with your nerves, your muscles, your other soft tissues, your bones, whatever, if it's something that does not require surgery, which something really traumatic would require surgery, definitely, like you fall and you break a bone really, really bad. But otherwise, the aches and pains that we get that creep into our lives from like maybe like sitting at a desk all day, or maybe like you do the same kind of exercise and it's like a really repetitive motion, you get some breakdown, you get some knee pain or whatever. Physical therapists are like uniquely suited, and we are uniquely suited to be able to help you figure out like what sort of patterns that your body has, what sort of deficits that you have, and then like how to fix that. It's really easy to just like go to the doctor and get an injection, like a steroid shot, but like the steroid shot is going to decrease inflammation, but it's not going to address like why you got to the problem in the first place. And that's our thing, is like, let's get to the root problem, and then let's fix it from there. So you don't have to keep having the same thing, or that when it pops up, you know what to do about it. We're all about like giving people knowledge of their own bodies, their own patterns, so that like that empowerment is in their hands. PT isn't huge on Instagram, but there is a growing bubble of people who work in the like health and fitness field who are putting out really cool content on Instagram. And I've learned a lot from Instagram, especially like near the end of school. I got like a lot of different ideas and got exposed to different sort of treatment philosophies because of Instagram, because of social media, which is crazy. Because most people are like, get off of social media. It's wasting your time. It's whatever. But there's been some really cool things that I've learned, podcasts that I've picked up on that I wouldn't have gotten exposed to if it weren't for Instagram. My push to get us on Instagram came from wanting to join the conversation and wanting to get engaged with people who are on social media who tend to be a little bit younger. Hey, like, here's some cool information about your body, and here's information about us, and that we're out here doing this. Wanting to join that conversation and to engage more people is really what drove that for me. I spend enough time on social media in general and in the little PT bubble that I feel pretty comfortable knowing what kind of stuff we should post or like what's engaging or what's not. And we learn more and more of that, like, as time goes by and as we see what other people are posting.
And it's crazy that that's kind of the world of that's how we consume now. And we consume things in 15 to 45 second clips, like TikTok and Instagram. It's a great example of like, that's how we consume things. So let's kind of talk about some of the main pillars that you have. And, I've researched throughout your page and, your company and things like that. There were a few foundations that I saw. So I'm gonna name a few of them and I'll let you guys go in depth on them. So you guys talked about bodies are asymmetrical, everybody's resilience, find the cause of the problem, and movement equals wellness. And so I want you to just go more in depth on those four things and kind of educate all of us.
Basically, if you look at our main cavity here, like our abdominal and our thoracic cavity, like if you were to open us up, like our organs are not asymmetrical. Like we have a liver on one side, 3 lungs on one side, heart, three lobes of the lung on one side.
I was going to say, I didn't even know we had 3 lungs. That's incredible. That's incredible. That's like, this is brand new stuff. It's all over PT Instagram. breaking news.
So we, basically like our organs are asymmetrical. So that's going to kind of shift our weight one side to the other. So naturally, we are going to be more of right-sided oriented people. Now, it doesn't mean like hand dominance. It just means of like how we move is going to be more right-sided oriented. So our spine starts to the right, rotates easier to the right. Our diaphragm works better on the right than the left. So our diaphragm is the big muscle that kind of like comes under the rib cage. That is our main like way to like bring air in. And so it's easier for us to contract like one side versus the other. So that asymmetry leads us to essentially like looking at exercises of how we can help people move from one side to the other without compensation. And we believe that compensation can lead to some tissue breakdown, and tissue breakdown may or may not lead to pain. That's another, like kind of rabbit hole if we want to jump down that. But, that is kind of the asymmetry we talk about. So if we're thinking about that organ asymmetry and how our body is going to weigh different right to left, how it breathes different on one side versus the other. And then, like I said, from that, our spine is going to be oriented to one side. And it's how do we move from the right to the left and back to the right without compensation.
And we really start at the way that we look at the body. We start at the middle, at what the rib cage and the pelvis are doing, what the diaphragm is doing, and we move out from there. So then we might start to talk about what are the shoulders doing, what are the muscles around the shoulders doing, what are the hips doing, what are the muscles around the hips doing, and like down. So we start very central and work out from there. So like we see patterns here, and then based on the patterns that we see here, we know we have things that we're expecting to see or expecting not to see, like further out the body that we then address. So a lot of the exercises we do, a couple of hands-on techniques that we do start here, rib cage to pelvis, and then move out away from that, depending on exactly what's going on. Different from what other PTs might do or other like healthcare professionals might do, but we think it works really well for our bodies and for other people's bodies too.
Yeah. And it's like, how can we position your body in a good spot to where your muscles work in an ideal like range? That's probably the biggest thing that like we want to get out of this is like, we want to get your muscles like working when they should. Like every muscle is there for some sort of reason. It wasn't just like put there like randomly, like, oh yeah, we'll just give you that. And it's never you don't need that. So we want to try to get your body into that good position. So that way your muscles like are working like in an ideal range. I think a good way to think about our bodies is that like, our bodies do a really great job of healing themselves, and a really great job of moving and accomplishing tasks with like structural damage or like structural like abnormalities. I think one research study, I believe it was done in like Britain. It was like a systemic review they did when they were trying to redo their healthcare system because they had such a backup of patients when to go to orthopedic surgeons. So it was like a 6-month like wait time. Like, how do we cut down on this? And what they were finding was that like the shoulder surgeries they were having basically had a 50% success rate. Actually, like having surgery on the painful tissue. Basically, like when you look at MRIs and that sort of stuff, they're going to show damage in it, but that doesn't necessarily mean that you're fixing the problem by like fixing the damaged tissue. So like our bodies are pretty resilient. Like it can fix itself a lot of times, even though you have like damage in there. So I think that's the cool thing about physical therapy is that like we have an ability to really help people like get to where they want to go and solve problems that allow them to do the things they want to do without having to go into surgeries, without having to go to PT after surgery and then have another surgery and another surgery. So like basically like we're facilitators, like for people to like allow their body to heal themselves. Like the patients and clients do all the work. Like we just help coach them along. So I think that's like the cool part about our field.
And that's why too, like I wanted to just talk more to the two of you because that's very aligned with me and the things that I've researched and I've learned about is like you want to just avoid surgery, prescriptions, like all of those things that are just not natural as best as you can. And just, you know, the things you can do just by eating correctly and just exercising yourself and moving and all that. It's just crazy versus, you know, just trying to, I'm gonna go get this surgery or that surgery, or I'm gonna get it put on this medication for the rest of my life. And it's cool to hear you guys talk about that because that's very much in line with the research that I've done and just kind of what makes sense when you really think about it. Like, we didn't have surgeries and prescriptions for thousands of years. Like, you know what I mean? It's if you hurt yourself, your body fixed itself through, you know, movement and all that kind of stuff throughout the past. So I guess that also probably leads to find the cause of the problem. I've never heard that phrase. So if you guys want to go more in depth on that, that'd be great. I love it.
You know, a lot of the time, so a good example for this one, I feel like is knee pain, right? Knee pain's very common. It's something a lot of people have experienced or experienced for a little bit, or it can even be debilitating, right? So if you look at, you're like, okay, I have knee pain. That's my problem. You're like, what's the cause of my knee pain? Maybe you go see a general practitioner, an orthopedist, or whoever. They image your knee and they say, hey, your meniscus, the little cushion that's in your knee, your meniscus is torn up on one side, and that's why you have pain. So then we say, okay, well, you have knee pain, and you have an image that shows that your meniscus is torn up a little bit. So that could be the cause of your knee pain. Your knee pain also could be from something else, but what caused your knee tissue to break down in the first place? And are you necessarily doomed to have like knee pain and problems for the rest of your life just because you have like a tear in your meniscus? And our answer is no. So our answer is not just like, or our answer for like cause a level above that is, why did your knee tissue break down in the first place? And the knee is a good example of this because the knee is sort of a dummy joint in that like it's this hinge joint, right? That is really controlled by what's going on at your foot and w's going on at your hip. And for most people with knee pain, we're going to find deficits in function or maybe mobility or strength at the hip and at the ankle and the foot. So for me, if someone comes in and says like my knee hurts, I'm going to say, okay, your knee hurts. And it might be because like this tissue is like irritated, but ultimately the cause of the cause is that like you lack some strength in your hip, or you lack some strength in your foot, or motor control of your hip or your foot, or maybe range of motion in your hip and your foot. And then I want to do something to your hip and your foot to actually like restore them to optimal function. So your knee doesn't have to just take the beating.
Which is different than what you would think, right? So you would think, if I was just a normal person, my knee hurts, I need to go get my knee fixed. Like I need knee surgery. And people are quick to go, yeah, for sure. We'll give you this knee surgery. And then in 2 or 3 years, you're right back in there because you're knee surgery. Just like if you are, very obese and you just eat really poorly and then you get heart surgery, your odds of going back for heart surgery are very, very high because you're not going to change the foods that you're eating, right? Like, it's like, again, it just makes so much sense. Why is it that you guys think this way, but the majority of, maybe not so much the majority of people in your profession, but in the majority of the world thinks I just need to get my knee fixed? Like, why do you think that is?
I mean, it's easier, it's quicker, right? Like, it's easier to be like, oh, I just have to have this one thing removed and like everything will be fine. And like, I feel like some people, like at least people that generally come to physical therapy that are maybe closer to our generation, I think maybe are starting to realize that a little bit more. And it just might be like, you know, the bubble of like being in Austin, because Austin's a pretty active place. People know that they need some conservative stuff or some like change in their movement patterns sort of things. But I do think it's the ease of it, honestly. Like it's the idea that you can do this one thing and it's fixed. Because a lot of times surgeons won't even say they need PT until after the surgery. Like they're like, okay, now you need 6 months of physical therapy after the surgery before we can even talk about
surprise.
Yeah. And people are like, I didn't even know I needed to do that.
I mean, I feel like very fortunate to be in a place where I have an understanding of how interconnected all of our body's systems are and how interconnected all of our body's parts are. And it's very easy to, I mean, it's easy to look at any part of the body this way. And that's just sort of the way that people look at it. Just like my knee hurts, it must be my knee, or like my stomach hurts, I can't be related to anything else. It's just my stomach, or like I have trouble breathing sometimes when I exercise, like it must just be asthma, like nothing else must be playing into that. Like it's just, that is what it is. Like people tend to want like a really boiled down sort of answer. And there's a lot of like really beautiful complexity. And it's just like the beautiful complexity is harder to get into, but there's truth in that, and there's answers in that. And it doesn't have to be super ridiculously complex, right? Like it's not crazy to think that what's going on at your hip and your foot control what happens to your knee.
Yeah.
But like that's a new idea for a lot of people. So like getting that out there, like your body's parts are connected, everything's, you know, all together in a lot of different ways, mechanically and like neurologically.
I feel like it also goes into like a little bit of like kind of like black and white thinking a little bit, like, which, you know, is an epidemic in and of itself.
I mean, that's a cultural
right?
thing in America for sure.
Yeah. It's so hard to think of like something being a gray area of like, okay, like you can have this problem, you can have like a tear or something like that, but you can fix it, right? It's not just like you have a tear, have to get it like surgically repaired, and then it's good. Like you can live in this gray area and live completely a fine normal life. I was saying today, like I'd love to get an MRI of my body and know like how like many things are just like you know stuff. And I feel like I operate at a fairly decent level, fairly high level as far as like my physical activity goes, and you know I have no real complaints about it. So you know it's hard for people to understand that, especially, I mean, people are busy in general, right? Like you know a lot of people like you know, aren't prioritizing their health as much, where they want to just like dive into it. You know, it's just like, this is just a headache and I just need to get out of pain. And then once I'm out of pain, I'm not going to worry about it anymore.
Nice. Well, thank you both so much for coming on. We really appreciate it. It's cool to know what you're all about, and looking forward to, you know, a few more episodes coming up where we talk about, you know, a lot of the stuff that you talked about already and just going a little bit more in depth. But thank you guys so much for coming on.
Thank you so much
for having us.